All right, welcome everyone. We are happy to be here today. My name is Sean, presenting here with John. We're going to be talking today about the prevention and mitigation of alcohol and drug use within an MTSS framework. And I know this is for a school climate transformation grant, so welcome all of you. My understanding is that you're from a range of areas in the country. We're excited to learn a little bit more about you, but we figured we'd give a more detailed introduction of ourselves. And so my name is Sean Austin. I am a doctoral candidate in the special education PhD program here at the University of Oregon. My background is as a school psychologist, and I also worked as a substance abuse counselor and adult outpatient for about a year and a half before going to the education field. Also, I'm a father of three little boys under 5 years old, and they constantly have something to say and keeping me busy. So, John, go ahead and introduce yourself.
Yeah, good morning, everyone. I'm John Seeley. I'm a professor and associate dean for research in the College of Education at the University of Oregon. Sean and I also serve as the resource directors for substance abuse for the National Technical Assistance Center for PBIS. We're happy to be here today, and it's early for us. We're just getting started at 8 o'clock, and so hopefully we'll warm up as we move along here.
Yeah, and I know that school staff in particular don't have much don't have much sympathy for an 8 a.m. start, but that's a little early for academia right now.
Yeah.
COVID as well. All right, and so we're hoping to get to know a little bit more about you, as we don't know anything about where you're coming from. And so we have a link that Austin will push through the chat here, linking to a Pull Everywhere site where you can answer a few questions that kind of take us through where you're from, your role in the school, things that you're hoping to gain out of today. And so, John, can you confirm that has been sent through? Because I don't have a chat open right now.
Yeah, so the link is in the chat. And so if you can click on that right now, and it's just a really brief poll, and then we're going to pull up the results to share with you who's on the presentation today.
Yes, I will pull that over. Wow, we got some responses going already. This is great. I will pull that over here. All right. And we'll see that. So that's all the responses and how far people are through the survey there. We got quite a few that are even started, so I won't even go to the who's here yet because we've got quite a few. I love the participation. Thank you so much for doing this, because this will help us in a couple ways. I mean, obviously, it's just interesting to know who's coming when you've got maybe a national presentation, but also, when we know who we're talking to as far as school personnel and the area, we can speak a little bit more to maybe those regions or those roles.
So, Sean, there's still 31 underway, and some of them have completed.
Excellent. And so, because this is a question-by-question survey, we can see probably most people that anyone that's entered the survey, it's the first question they answer. And sorry, I'm looking over here, but I've got two screens, so that's that's why. And so we have 0 teachers in here, which I was not quite expecting. A lot of district admin, but mostly student support personnel. And that makes sense, I think, when you think about how a lot of the responsibility shifts to support personnel for a lot of these student needs.
Right.
I feel like that's pretty stable. So let's check out the next one. So what student grades do you serve? And we've had some differing responses on this in other presentations. John and I presented a couple different times for similar content, and we've got kind of this pretty good range, and typically it trickles more to the high school and secondary grades. But here we've got a pretty good split between elementary and high school. And middle school, not as much, which I'm a little surprised about. But you're all welcome. It's all good. Again, this is helping us know who to talk to here.
And elementary is a really good time for upstream prevention, and we'll be talking about that upstream prevention as well.
Yes, absolutely. Yeah, it is completely relevant there. All right. And I'm detecting one state above others. I don't know about you. We've got a lot of people from Georgia, which is great. And actually, that's it. We're doing some research that'll be coming out of some Georgia data too. So we'll stay tuned for that. Illinois, California, Florida, Kentucky, Virginia, Washington, Minnesota. We've got from all ends of the country here.
Yeah, but a little bit lower showing on the West Coast, and I don't know if that's because of the time. But yeah.
I have to think that didn't help. But yeah, okay. So I'm thinking more along Central and South, right? Georgia, Florida.
Yeah.
All right. And then the school district currently implementing the Interconnected Systems Framework. And we've got a pretty good split there, and then a pretty good chunk that don't know what we're talking about yet.
Right. So hopefully the will go away by the end of the presentation.
Yeah, we don't have a post survey on whether or not you're still confused about that, but it should be pretty well outlined for you here. But we will get your feedback regardless. It just won't be on this specific item. So yeah, we've got about a third of participants are using the Interconnected Systems Framework here.
That's great.
Now, what supports are available to you in your district related to substance misuse? So we've got a lot of outside counseling, referrals, some hospital coordination here, public health department, some being honest and saying very little, and others having some school curriculum in place when we talk about the thought and life skills and paths there. It sounds like Georgia has hope, which is good, and also probably maybe a state-specific program that I'm not too familiar with. Very limited. I'm not surprised to see some of these saying very limited. I think, this is a newer area for schools to manage. So, and we're not necessarily designed to do that, at least in my personal experience.
Yeah, and I notice counseling and mental health counseling, and we're hoping to broaden the counseling to be behavioral health and really follow the behavioral health integration that's occurred in primary care, where we deal with both mental health issues and substance abuse issues and substance misuse issues.
Yeah, absolutely. I think broadening that understanding is important for thinking about how we deal with and support students that are struggling with these. And just one mention here of being severely understaffed in this area, and that is something that, from what I gather, is a national issue. It's at least relevant here in Oregon, but I think it's a national issue specifically for like pediatric and adolescent care. And I wanted to make sure I didn't miss anything down here. Currently collaborating with outside agencies regarding substance abuse. That's great. That's great. So let's see. We can go to the next one. So what do you hope to gain from the session? Proactive rather than reactive interventions. Got some good news for you there. We will be talking pretty extensively about that and then how that works within ISF here. Learning how to address the issue from MTSS. Any insight? Well, we can fulfill that need. We'll give some insight. Better embedding prevention, and so that's great. I love that we're seeing school staff thinking about like prevention on this aspect. I think so much of what we've done in schools historically has been reactive, and I think that's also reflection of larger public policy as well in our country. So I'm thrilled to see, and not necessarily surprised to see educators thinking from that prevention lens. And so having some resources show parents, excellent. More ideas for support. All right, let's go and get started with the rest of it. So I will pull this away. And we'll actually get to some of that content, but it's good to know where you all are coming from. And I appreciate you participating in that survey, as that does help us. And so we had a total of 35 finish that survey by the time we went through it. Okay. So the agenda for today is to look at some adolescent substance abuse trends and what their impact is on schools. And then we'll look at how substance misuse programming can fit within the context of PBIS and the Interconnected Systems Framework, which are both forms of MTSS. And then we'll talk a little bit more about practice selection and refinement. John will do a nice job of kind of walking us through the considerations for that. And so we have just a couple main learning outcomes for us today. The first one is that we need to understand that substance misuse is a part of a broader behavioral health support issue. And so thinking about behavioral support and expanding through mental health and into behavioral health for substance misuse is important. Excuse me. And then we're looking to identify some strategies to bolster and streamline supports for substance misuse in MTSS. And that's going to be looking through primarily the lens of ISF. And here, John is going to take us through some trends.
Sure. And so before we get started on looking at some specific trends, let's start with kind of a definition of substance misuse. And so next slide, please, Sean. And so substance misuse is the use of a substance for a purpose that is not consistent with legal or medical guidelines. Obviously, for children and adolescents, that includes all substances, alcohol, cigarettes, vaping, as well as illicit substances. But we also need to consider the prescription drugs and the use of prescription drugs without a prescription for a reason other than the condition for which they were prescribed. Often, for example, opioids are prescribed for pain management, but they can be misused to get high. And so that's a key consideration. Unfortunately, some legislation in the last 5 years has restricted access through prescribing policies. And so we're seeing some improvement in that area. And then using the prescription or the drugs at a higher quantity, frequency, or a longer duration than prescribed. So this is a rather broad bucket that includes prescription drugs, alcohol, cigarettes, vaping, and illicit substances. So let's take a chance to see what you think are some trends in substances. So if you could populate in the chat, what have you noticed in your area? What are the trends that you're noticing in terms of substance misuse? And the question is not appearing on the slide there. There we go. Thank you, Sean. Vaping, and we keep hearing about vaping. We're going to talk about those trends. There are some recent evidence-based practices that have been identified by the Substance Abuse Mental Health Services Administration. We'll talk about that towards the end of the presentation about some of those emerging programs and practices. It should be noted too that the approach to preventing vaping is very similar to the approach to prevent tobacco use, and as well as the approaches for tobacco cessation. And so there's a huge literature on that can be leveraged for vaping as well. All right, well, I think an overwhelming response was vaping. So I guess we can proceed on to looking at some of these trends. So we're going to go through a few of these substances. And what do you think the trend is for binge drinking? That is the consumption of 5 drinks or more within a given setting period of time. Do you think those trends for youth are going up or down since the turn of the century?
Feel free to send it through the chat too.
Michael says down.
Yeah, Michael says down, but a couple up.
Up, down, up, down.
That is a mixed response if I've ever seen one.
Right. And again, what we'll be showing is the prevalence rates for consuming 5 or more drinks in the past year among adolescents. And this is coming from the Monitoring of the Future survey, and you can see for all grades, there has been a reduction since around the turn of the century. And you can notice those last few data points that during the pandemic, there actually is a positive consequence. It's weird to think about that, but that the rates of alcohol consumption or binge drinking have gone down. And so that's consistent across the grade levels. So how about cigarettes? What do we think the trends are for cigarette use? Up or down? That's very consistent.
That's very consistent. Yeah. Good to flip that slide, I think.
Yeah.
No surprises there.
Yeah. And so, again, over time, we're seeing actual cigarette use decrease, and with a dramatic decrease during the pandemic. Obviously, part of that might be access, especially with isolation at home during some of those periods. And I'm wondering, too, how masking and other, policy changes may have an impact on substance abuse and substance misuse. And we know, too, though, that among the parents' consumption of alcohol and other substances actually went up during the pandemic. But we'll just talk about youth today. And so now here's the one that's coming up that I'll be curious what you think. What about vaping? Is vaping going up or down? All right.
And no one was even slow to respond to that. It was just like instantly filling up the chat. So
yeah. And so recently, it's a pretty new phenomenon that again, vaping just came about this last decade. And we saw a rapid rise and a huge increase right before the pandemic. But again, we're seeing a little bit of a dip here. I do not expect that data point and that dip to continue as we return to more normal practices. And so it'll be interesting to see what happens here after the pandemic has kind of resolved. And it looks like we're starting to get to that direction to open up more. And so will the trend continue to decrease? Hopefully so, with some prevention and mitigation strategies, but I'm not banking on it.
Yeah, another one of those, if you dare to say it, a positive aspect of some of this pandemic, I guess, response that we've had is that we've seen some of this reduction. But yeah, I don't necessarily anticipate that that trend keeps dipping down as it has the last couple of years.
And so, how about prescription opioids? And again, one of our primary focus today is on the opioid crisis and how any kind of substance abuse prevention and mitigation strategies will help address that crisis. But what do we think are the trends on prescription opioids? And survey says there's actually a decreasing trend, and we saw that decrease really start kicking in when those prescribing policies changed to limit the amount and the dosage of prescription opioids like OxyContin and Vicodin. And again, we see this last data point as a decrease. And so overall, that's a nice trend to see in the prescription opioids. But if we look at illicit substances overall, the trend has been fairly stable. If you look at the next slide. I just gave it away. And so I forgot that was a question, John. And so we might, since I blew it, it's actually been fairly stable with a little bit of a decrease this last couple years due to the pandemic. But we see that illicit substance use has been fairly stable over time. And if we look at the trends during since right before the pandemic and the most recent data points on the next slide, you'll see that the red line indicates no change. If it's below the red line, then there has been a decrease. And this is, again, from right before the pandemic to the most recent data point. And so for most substances, we're seeing either no change or a decrease. But as we've noted before, that there is an increase in vaping for marijuana and marijuana smoking. And so that's that one. Actually, it's decreased a bit, but it's still, we're seeing a trend, though, during the pandemic of it increasing a little bit compared to right before. So, and then we're going to talk a little bit, too, about students with substance possession referrals. So office discipline referrals over the last 7 years. Do you think those are increasing or decreasing? These are discipline referrals for possession of substances on campus.
One thing to clarify, these are pre-pandemic.
Right. Yeah. And we don't have the post-pandemic. Good point, Sean. Okay, so it looks like the referrals are going up. And the data from SWIS, the school-wide information system, agrees that they are going up. But what's interesting to note is that it's fairly stable for alcohol and drugs, and that the increase is really linked to the tobacco code. And again, that tobacco code, I'm assuming, is a lot, is related to vaping. But we don't have any way to confirm that. Is that right, Sean?
Yeah, that's right. Within SWIS, the codes are pretty simple in that it's tobacco, alcohol, or other drugs. And, we have to use some inference from other data, which you can see, in that vaping data that we just showed, those couple years leading into 2018-19 is where that spike was in the use of vaping. And it's a pretty substantial spike. And so I think that mirrors pretty well here. And I feel it's a pretty safe assumption, even though we can't directly confirm.
Yeah. And so although we have, some good news regarding some of the substance abuse trends over time, or substance use trends over time, and we have bad news around the increasing of vaping that we're seeing. If you see the next slide, the further bad news is that the mortality rate has been really skyrocketing, and that's primarily due to synthetic opioids such as fentanyl. And this graph is just showing the various illicit substances, and you can see that trend of that orange line is just jumped out. And the more recent data points, we're seeing in 2019, it was around 40,000. In 2020, it was around 56,000. In 2021, was over 70,000. So this is very alarming. Even though we're seeing prescription opioid availability decrease, there's now this turn to street drugs, heroin and fentanyl, and this is kind of alarming. We need to do something about this. We know that our students are impacted in our schools, and we'll talk about that here in a minute. There's also a new website that was developed from funding from the National Institute on Drug Abuse, and this website has been developed over the past few years, and it allows you to see the recent trends in your area. And I'm just looking like in the Atlanta area, given that we have some Georgia folks, you can see that data point. And there's been some drug seizures with MDMB, fentanyl samples, meth and cocaine. And so there's a pretty big surge in drug seizures in that area. And that's an indication of availability. And so it's helpful to look at this website, the NDEWS website, to monitor recent trends. These are the data points from the most recent report about 3 or 4 months ago in November. And so So that we're trying to get these surveillance systems in place to help with local planning, and hopefully these resources can be helpful to you. So let's look at the impact of the opioid crisis, especially on students. That's a major area of concern, and we know that for many students who report high-risk opioid use, initial exposure was to non-medical prescription opioid use early in middle school. And so possession of prescription opioids that are not for their intended purposes, that's a high risk factor for future heroin use. And so we really need to take efforts to, when we see these early indicators, how to intervene early on and prevent the escalation to more harder and illicit substances. And we know too, across the substances, peers use can influence individual risk. And so that's should be part of any kind of prevention and mitigation effort, is to involve the peers. Students also need help coping with traumatic home experiences. Children of family members who use opioids and other substances are at high risk for a range of problematic outcomes. Again, they're at higher risk for developing opioid use disorders themselves, have a higher likelihood of encountering traumatic experiences, and may be exposed to child welfare system. And so this indicates too that trauma-informed practices are kind of critical at this period during these crises, so that we can address the needs of those children who have been exposed to trauma. And families need help coping as well. These problems can be wide-ranging, but they include a loss of family members or a loss of a parent. When that occurs, there can be shifting roles within the family, and that can cause additional stress in addition to the loss of the family member. And when new guardians need to step in, such as parents, they may be novices in parenting children today compared to when they parented a generation ago. And so they will need additional supports as well. And so now we're going to, again, test your knowledge. The first question: alcohol risk-taking is usual or is unusual?
In adolescence. Risk-taking is unusual. So is that true or false? Go ahead and respond in the chat.
And my chat is covering the questions, so I'm trying to get them on my other screen, so I don't have to do this from memory, or you don't have to correct me.
That is a universal false, is what I'm seeing, chat.
Yeah, and you're right that it is false. It's really normative for during adolescence to do risk-taking behavior, including experimentation with substances. So the next question: true or false? Early onset is linked to dependence. Yeah.
And so, with that, we're just talking about early onset use of substances. So the earlier a person uses is linked to greater dependence later on. Is that true or false?
We kind of gave this away in the previous slide, so
probably.
Yeah, it's just testing whether people are paying attention, I guess.
You know what? They are.
Yeah.
We've got good indications here.
All right, so that is true. And again, these are pretty straightforward questions, but let's put the next question up. True or false? Early intervention is important. Yeah.
Got some enthusiasm on that one.
Yeah, I think we can put a couple exclamation points behind that one. Yes, very true. And so upstream prevention too, and thinking about what we're doing in general for problem behavior often has an impact on substance abuse. And so thinking about our social emotional learning curriculum early on can really delay and reduce the onset of substance misuse. And so substance use disorders are rarely comorbid with mental health problems. And this term comorbid means that substance use disorders rarely co-occur. And so this is saying that, do you think that they typically occur in isolation or with other mental health problems?
This is a sharp group. We've had other ones where they get tripped up on this, but there is no fooling the SCTG group today.
Right. Yeah. And so that is false, and they're highly comorbid. So that is one of the reasons that we are really emphasizing behavioral health integration and the focus on addressing both substance misuse and mental illness or mental health problems that may co-occur with the substance misuse. Also, by treating mental health problems, that is a prevention effort for substance misuse and vice versa, because there is a reciprocal association between one set of disorders and the other.
All right. And so with those ideas in mind, we know that a preventative approach is going to be probably the most effective, and one that meets students at their level of need. It's not just for intervening at the end when they have a substance use disorder, but intervening along the way and giving students skills and helping them work through issues more proactively is going to be the way to go. And so this graphic will communicate to you on that foundation side, that preventative framework that we're here to talk about, that's going to be a key aspect. Additionally, we want we need some alignment of policies, and that means, committed time to working on substance misuse programming, but also even think about discipline policies and how those can affect students with these needs, right? The student that is suspended is unable to access a lot of the resources and supports if they're engaged in this. But the first section that we're going to talk about today is these points of engagement, these recommendations for how we meet the needs of families, meet the needs of students, and meet the needs of staff with regards to substance misuse. And we've got a longer form presentation of this. This will be kind of the short bullet points of more or less the domains that we can approach that support students with substance use and exposure to that. So the first one, I don't think this is necessarily a big surprise to anyone, but it warrants a slide here. And that social emotional learning is one of those set of skills it has in it with the set of skills that I see Austin's posting in the chat too, so some resources that'll come along through that. SEL promotes skills that students engaging in substance misuse typically are lacking. And so we can view that as a preventative quality, being able to self-regulate, being able to think critically through, uncertain situations, being able to manage stress. Those are all things that if we support students preventatively, we can probably prevent some of the substance misuse later on. And so the way that we do that within schools, embedding social emotional learning, is both through prevention and mitigation. On the prevention side, those that are implementing PBIS could be embedding social emotional, skills into their school-wide expectations, so that there's a deep breathing routine that's built into being responsible. There's a stop and pause as a part of being respectful or being kind, and thinking about how others are going to respond to those things that I might want to say or do. In addition, there's universal curricula for social emotional learning that is more generic, doesn't necessarily need to be tied into school-wide expectations, but can still have some of that protective effect that we're talking about, because when students don't have those skills, again, they're more likely to engage in substance misuse later on. And adults, even this is evidence in adults too, have lower social emotional competency when we see they're tied to use later on. And then just broader mental health promotion, encouraging students to be in touch with their feelings, to reach out if they need help. And then on the mitigation side, we'll talk about counseling services here, where having students with resources where they can actually problem solve and deal with some of the issues that they're dealing with. Deal with some of the issues they have support in dealing with those issues in schools is important. In addition, targeted and intensive interventions for social emotional learning. Coping CAT is one that comes to mind, where we talk about being able to recognize signs of anxiety and be able to manage those directly, being able to work through that with, again, a trained staff member is going to be protective for students and being around substance misuse. As we know, substance misuse is engaged in frequently for, perceived reasons of, dealing with stress, dealing with anxiety, being frustrated, not knowing what to do, being depressed. And all of those things, I think, are going to be supported here with social emotional learning. And then monitoring those skills, I think, is another way for staff to have a read on whether or not students are progressing and whether or not they need more intensive supports. There's a lot more on this in that link that Austin's provided there, which is a link to the pbis.org website, where it talks about how you can teach social emotional competencies within a PBIS framework. Next, alternatives to exclusion. So on the prevention side, I'm not going to talk too much about that, but knowing that we can prevent some of the exclusion that might take place related to substance use by, increasing rates of supervision, by, instructing actively on that, and really building relationships. I'm not going to harp on that too much, because a lot of the alternatives to exclusion are going to be in that mitigation side when we're talking about students with substance misuse. Because when substances come into play, that's almost automatically an exclusion in the school setting, whether that's suspension or expulsion. I've seen it both ways as a school site. It was my first year. I was dealing with manifestation determinations in the first week of my first year because of the student bringing cannabis to campus. And that resulted in automatic expulsion because of the board policy. So understanding that those policies really can dictate what administrators can do, and I'm sure the district administrators can speak to that here as well. A lot of it starts there, but beyond that, if you have the policies in place that prevent some of that exclusion, looking at alternatives such as restorative approaches, being able to refer to counseling and even refer to outside support, within the community if available, those are going to be essential, like replacement steps for that exclusion.
Yeah, and exclusion really does fuel the school to prison pipeline too. There's unintended consequences of, kicking the kids out of the school that they then may have more time to actually engage in problem behavior. And so we really need to think differently about this if we want to disrupt that school to prison pipeline that we've seen kind of increase over the years.
Yeah, there's lots of research on that and how exclusion doesn't necessarily support the school or the student for many of the reasons that John just described. So the next recommendation would be to use substance misuse expertise, employing people who have knowledge and experience with substance abuse treatment and mitigation will support your own programming. And so a lot of schools are not necessarily in position to hire directly for this, but this can be reaching out to outside providers and seeking collaboration. Sometimes it can be compensating for their time. And actually, there are some larger districts, if you're in a bigger city where you might employ directly, certified alcohol and drug counseling staff. But employing them in a system that is, designed to take their input and thinking about within schools having a single system of delivery where those personnel can inform like school-based practices. That's this idea of ISF, where we're talking about the interconnected systems framework. And that's pushing school-based mental health into an MTSS framework. And there are a couple great resources for you below that have also been shared in the chat, and will be shared after our presentation through a PDF of the slides. And these are coming from the pbis.org website. PBIS and mental health, and then also installing ISF, which I think that was a little bit longer, but still going to support your efforts if you're kind of new to this ISF idea. And then the next recommendation here, and I think there's only one or two more after this, but with substance misuse being such a thorny issue, being one that has, it affects so many aspects of a student's life, and family is going to be by far one of the things that's supported in research. You need to engage families in this work of prevention and mitigation. And so the things that schools can do for prevention through family engagement, you're sharing information, so maybe newsletters. You're sharing services such as like drug disposal. One thing that I want to just hit on, because we're talking about a lot of the opioid crisis more recently, understanding for like communicating and understanding for parents that opioid use starts usually in the home. You've got all of these medications that are often expired that haven't been thought about for years, but if they're sitting in a cabinet, that's not an infrequent place for an adolescent to find and start using. And unfortunately, we know that does open the door to some of the synthetic opioids that we've already talked about that are increasing and driving mortality rates. So it's a simple piece of knowledge like that can prevent, who knows, dozens of cases within an individual school district. If a parent is more aware of what those risks are and can mitigate those in the home, that's going to go a long way. And so additional aspects of, I guess, parent information sharing would be, or caregiver information sharing would be like training on monitoring. John had talked about how we might have renewed novices, in parenting, where we've got, atypical family structures and caregivers that may not have expected to be in the position of caregiving. And so offering services for those families can go a long way toward, again, understanding what the current risks are, because those are different between generations.
That's right, Sean. And parenting skills training, that is one of the most focused substance abuse strategies that has a very solid evidence base. And as Sean mentioned, part of that is skills training around monitoring, but peer affiliation. How do you provide positive support to your kids? And there's other specific skills that parents can engage in to improve communication and relationships with their children. And so that's a very strong recommendation in terms of family engagement. And there will be resources that we are going to reference towards the end of this presentation in that regard.
Thank you, John. And so on the mitigation side of family engagement, we're looking at how do we incorporate parents in our services, specifically for Tier 2 and Tier 3 services. It's often the case in my experience that schools will operate in a way that's just, well, we have the student at school, we're going to engage the student. And in this instance, when we're talking about, even social emotional skills, if that's your Tier 2 or 3 service for a student with some of these issues, coaching the parent on maybe what some of those cues are, on what some of those strategies are that the student is using, and even welcoming them to a session where they can see how that instruction looks if there's time. I know that's often a limitation, but nonetheless, having the offer might even enhance the relationship between the school and the family. Also having referral resources and even a liaison to community providers, that's something that's being bolstered in Oregon. We just learned about recently, where family liaisons are being explored as a potential resource that can help caregivers negotiate between what the school is saying and what community providers might be able to support with, because the schools often aren't providing every resource that a student needs, and probably not capable of that. So being able to have someone that knows how those systems work, can provide, warm handoffs and referrals, is going to support those caregivers in meeting the needs of the students. And so I can't emphasize that family engagement. I can't emphasize enough that family engagement is going to be a really essential part of substance abuse prevention mitigation. And so then we also need to think about how we prepare staff. And so this is that third point there on that initial slide for this section. The teacher practices that we're supporting, we need to support staff in, we talk about trauma-informed practices, but also looking at school-wide PBIS practices, even as there's some evidence that PBIS on its own is associated with some reduced rates of substance use among students, as reported by staff. And then also just on broader behavioral health and wellness, helping teachers understand that this idea of substance misuse is a part of a broader spectrum of needs around behavior that includes mental health, that includes, even behavior disorders specifically. And then making sure that staff are aware of and trained on what the referral process is if they see a student that's struggling, because we don't expect teachers to deal with everything on their own. Having a procedure for managing incidents within schools. Sometimes those things are unwritten. It's a good time to get those things written so that people can be trained on it and know that in the event that it occurs. And then community academic partnerships where schools might be able to engage with local post-secondary institutions, colleges, universities for training on things like social emotional learning or behavioral health programming. And then this last one is looking at what schools do in emergencies. And this is most relevant to overdose for opioids. And so planning for a drug overdose is something that I don't think many schools necessarily think they need to do. But this is something John and I have talked about a lot as we've talked about what to include in these recommendations. And we find that this is still a better safe than sorry situation. In the chat, Austin has just dropped a resource for the opioid overdose prevention toolkit, which walks through some essential steps for first responders, but understanding that staff can identify what signs are of overdose of opioids, and then having a system or procedure in place for notifying first responders and even administering these opioid antagonists can save lives. A lot of these opioid antagonists, I think like Narcan is one of them, where they can be administered through a nasal spray. And so it's not anything that requires advanced medical knowledge, but could be applied, in this instance if a student is non-responsive and you may only have minutes to act. It's one of those that seems a pretty relatively low cost measure to have in place just in case.
And a large number of college campuses have adopted such emergency protocols. And since we're seeing substance misuse and abuse occur at younger ages, we're recommending that these protocols be adopted, especially in high-risk areas, but within the high schools and potentially within middle schools, but at least within the high schools.
All right, and so now we're going to be talking through responding with ISF. And so this is looking at that foundational aspect, that preventative framework that includes, a centralized team, excuse me, is having systems in place, being able to use data to inform your practices. And so when we talk about prevention, I think the essential aspect that we engage with is systems. And we need to respond with systems. This means, having flexibility and ability to pivot within your teams. It means essentially applying a multi-tier system of support because these pervasive issues require coordination across tiers. And substance misuse is a great example of that. But even behavior is a great example of that. When you've got systemic challenges, I know that there are people in this in this session. I don't know anyone personally, but I know that there are people in this session that are dealing with an increased rate of fighting in their schools, right? And so understanding that this is something that you can address across different levels of need, right? You've got this universal tier, you've got this target, and you've got those intense tier where you've got, individual students that are repeatedly engaging in fights. There's different things that are appropriate for the students across that spectrum. And so how can we do that with substance misuse? A great example is trying to apply that PBIS structure to mental health. And so this is pushing school-based mental health into that structure. And it's what we come to know as ISF, which we've already touched on a couple times.
I'm curious, we just got in the chat that there's 10 more scheduled minutes. I thought this was a 90-minute webinar.
I'm guessing not, based on that chat, which is unfortunate. John, how would you like to proceed with that, knowing that we've got...
I just want to first get some confirmation that we don't... Okay, others think that it was 90 minutes? Yes, okay. Whew, I almost thought we were going to be in sprint mode here.
Yeah, that was going to be a quick few slides here. Okay, all right, that's a consensus. Thank you, Slet and Tasha, Melissa, Pat. That is great.
All right.
Okay, so ISS, as we've talked about, is a single system of delivery for mental health support. Philosophically, we're integrating services into schools for behavioral health. And that means using evidence-based practices or, promising practices that we're aware of. And it means addressing social, emotional, and behavioral health with the same level of attention as academic achievement. And instructing the whole child is something I think is growing as like in the field of education. But this is, I think, still pushing it a little bit more than it has been pushed in recent years, thinking about dealing with substance misuse in schools and keeping students in school, even though they've brought a substance to school. Like, remove the substance, but let's still teach that student. Let's still help that student develop skills to cope with whatever life stress they're engaged with. What it requires is a reconsideration of how we foster behavioral health in schools, understanding that, even if we have a substance misuse, tier 3 issue, that we can do things in tier 2 and tier 1 that prevent those tier 3 issues later on down the road. ISF is always going to include partnership with behavioral health providers and partners, and that it's flexible on how that looks. And that's the part that some people, I think, sometimes get stuck on as well. I don't have the space to hire. I don't have the funds to hire. But you don't necessarily need to. It's about a partnership. And so you can engage with those providers, invite them to meetings, inviting them to consult even, making those steps to integrate those staff in whatever way that you have capacity to do can aid your systems and design and development. And there's a resource there as well on interconnecting school mental health and PBIS that I think should be sent through the chat as well by Austin.
Yeah,
that's how you're doing behind the scenes.
Yeah, that's the new volume that was released about a year ago. And it really has a lot of important resources, especially drawn upon implementation science and active implementation frameworks. So I highly recommend anyone interested in implementing ISF to take a look at that volume.
And so why do it is maybe a question that you would be asking if you've never heard of ISF up until now, and I'm just talking about it's this integrated system and we're including expertise. Well, some good reason is that it's effective and that it's supporting students actively who may not otherwise be supported. This is a borrowed slide from an OSEP presentation, Office of Special Education Programs, where they presented on a study that looked at 2 years of intervention versus a comparison group, and they had 8 schools that were randomly assigned to conditions of PBIS and school mental health, or ISF. And the key findings were that these schools that engaged in ISF, meaning that they had these integrated staff, that the these supports were all integrated within the school were many. There was some improved tier 1 programming. There was more involvement of school leaders and clinicians on MTSS teams. And the measures that you would see directly in your schools, schools were proactively referred for tier 2 and tier 3 supports rather than waiting until, hit the fan, which is, I think, going to be very welcome with this group, as we've got so many that are prevention oriented. So think about being able to proactively refer those students that you saw maybe were going down the pike, but you didn't necessarily have the system or the interventions to refer those students to. That's really helpful. Reducing in-school suspensions and office discipline referrals is another outcome of implementing ISF, and then reduced out-of-school suspensions and ODRs for students of color, which is another issue in school discipline that is getting a lot of attention now, thankfully. But we disproportionately refer students of color for a full range of behaviors, and so it's not necessarily incumbent on them, but rather what are we doing as systems and how can we adjust those things? So ISF is supporting access to those services, and reduction of school discipline. And so those advantages that we're applying, when we talk about, school mental health and PBIS versus ISF, the advantages are going to be in that alignment of services and the continuum of services across, tier 1, tier 2, and tier 3. There's going to be enhanced coordination among staff, and this, especially having that expertise built into the systems and teams. There's going to be improved access of services. That's another outcome of ISF, is that we see students engage more with mental health services over time. There was a study of, just school-based mental health services versus, clinic-based, and the follow-up and retention for schools is dramatically higher than the follow-up and retention within clinics. And I think some of that has to do with, the ease of access. School students are already in school, but it could be, a number of things. But regardless, you see that retention in services, students engaging in counseling more often over a longer duration, you're more likely to see those desired outcomes.
So let's take a look at the core features of MTSS as they align with the Interconnected Systems Framework. And so there are 6 core features within MTSS. The first is an integrated team process. Sean has already talked a bit about this, but the key here is use an existing team. How do you, help to add expertise to that existing team, and that they should be at different levels. There's a district and community leadership team that ISF leverages. Expand and merge teams with similar goals and with corresponding levels of support. And this can be done by including staff, again, as Sean mentioned, community partners with substance abuse expertise. These could be licensed alcohol and drug abuse counselors or certified alcohol and drug abuse counselors. We need to address the barriers to improving an integrated effort. Again, we tend to approach these issues in a siloed fashion, that there's mental health intervention, there's substance abuse intervention, we might even have suicide prevention. These are really interrelated, and the prevention efforts often have what is called a multi-finality approach or impact, in that some of these features that we do in terms of upstream prevention will actually prevent mental health issues as well as substance abuse. So we really need to think about those barriers that maintain the silos, and how do we break down those silos. We need to review and provide resources to meet the identified needs of these teams, have the capacity to implement with fidelity. We'll be talking about a tool that helps you gauge that here in a bit, and the fit with the school and community context. That's a very important is how does the initiative that you want to undertake align with the values and the policies within your community. Another core feature is expanded use of data. And so we've already presented on how to leverage discipline data to see increasing trends, such as the tobacco, and we're assuming it's the vaping issue that is responsible for that increase increasing trend. In addition to discipline data, staff surveys, especially their perceptions of student use. But we should also not forget about the staff themselves too and their own wellness. That's another conversation. But again, we need to think about the whole school and the whole community when it comes to substance misuse and abuse. And then student surveys, that's very critical to get data from themselves about their own use. And we can use that for surveillance over time. There are relevant community data sources on substance misuse and abuse. And one was that in the National Institute for Drug Abuse website that identifies current trends in your area. And so if you are seeing spikes in, for example, overdose deaths, that might indicate that you would want to have a safety protocol and an emergency protocol within your school to prevent overdose deaths. There's regional prevalence and trends on substance use from the CDC. Unfortunately, those data are usually delayed a year or two, but they do let us know how our trends are occurring over time. We need to incorporate substance use data with other mental health indicators. Again, given the high co-occurrence between substance use and mental health problems, by identifying those kids at risk for mental health issues, they would be an important target audience for prevention of substance misuse. And we need to continue to identify needs and monitor progress over time. This will allow us to do plan, do, study, act cycles for quality improvement and identifying which initiatives are working, which ones may need to be de-implemented if they're not working, and then how to address and supplant new initiatives to address the emerging needs. And then a key aspect to all of this is how do you select a practice or a program to implement within your school or your district? And fortunately, there's a lot of tools available that help those in the field, those in schools, identify the aspects of an evidence-based program that may fit their setting. And so the Hexagon tool that is displayed on the right, that comes from the National Implementation Research Network and is specifically the active implementation frameworks. This tool allows you to identify the implementation setting indicators, and those would be the ones in blue around the need that you're trying to address. And as Sean talked earlier, it really needs to fit with what and align with other initiatives and whether you have the capacity to actually implement and sustain. The key here, too, is not just adoption, it's really a sustainment. So how do you vet early on whether you can adopt and sustain an evidence-based practice given the resources you have at hand? And of course, we need to look at the program indicators of the evidence. Is it identified as an evidence-based practice? And a lot of times these practice lists like blueprints or SAMHSA, even though they've no longer have their best practice list updated, they do maintain high quality resource guides and continue to identify promising and emerging practices that to recommend for schools. We need to draw upon practical problem solving and evidence-based approaches for broader substance use problems. And again, if we're thinking about the opioid crisis, there's not a specific program that's out there to really address opioid independent of addressing other substance misuse. So prevention of substance misuse is prevention of opioid use disorders. And we need to think about that, that we should be trying to take an effort to address all substance misuse, not just one substance at a time. And the team needs to assess implementation and program indicators, as I mentioned. And this obviously would apply across the three tiers. Are you identifying a universal prevention program? Are you trying to identify a program that would be for the high-risk individuals or those that are actually misusing and abusing and need tertiary level supports? One of the features of MTSS is screening, and how do we use existing data sources for screening? One of the gold standards that has been used in primary care is called the SBIRT. That's the Screening, Brief Intervention, Referrals, Treatment. We're seeing a trend now where a lot of schools are adopting the SBIRT protocol, typically at tier 2, those that are at high risk, and trying to identify those who require brief intervention or those who really need to be referred to treatment. In addition to this SBIRT protocol, which often will have initial screening question, it's kind of a multi-gating procedure. They often are dovetailed with these other screeners, and CRAFT is one that's commonly used in schools. And it helps you identify the severity of the substance use based on kind of the risk factors of where it's used and why it's used. There are some other scales that have been validated for adolescents, including the Adolescent Drug Involvement Scale, the DUDIT, and the AUDIT. Of course, we need to track fidelity and impact, and the fidelity needs to pertain to the multi-tiered systems that support specifically like PBIS, and there are these fidelity inventories that are available on the PBIS website at the district level. There's the TFI, the Tiered Fidelity Inventory, used at the building or school level. And then there's a complementary ISF implementation inventory that looks at, again, the fidelity of implementing the ISF features within a multi-tiered system of support. We need to assess the effectiveness of behavioral health and substance use interventions. And so that's fidelity monitoring of the evidence-based practices themselves. And that helps you to see whether further training is needed or additional technical assistance and coaching, or whether the intervention itself is does not fit in your school, and that you may need to pivot and do some other intervention approach. And then we need to examine data trends over time to determine ongoing needs of the students. And so, this fidelity tracking is very important to make decisions and to employ, again, these quality improvement cycles of what do we need to do to make sure that we're implementing the models as intended. And Sean already talked about this, but professional development is critical. We need to do that on MTSS practices in general, but more specifically on effective behavioral health integration. There are some trainings that are available to increase mental health awareness and reduce stigma. Behavioral health and wellness trainings are kind of critical, as well as the wraparound service integration. Again, those wraparound services we consider at Tier 3, and that's one of the most effective approaches to connecting with the community providers, and so how to set up those systems. And as Sean mentioned, these community academic partnerships, that's where technical assistance can be provided. And the PBIS National Technical Assistance is a good example of that, where we have universities across the nation and that have an emphasis for regional support. And so you should draw upon those universities that provide that support.
Okay, so I teased this a little bit earlier, but when we talk about how the ISF enhances some of these services, I mentioned these advantages of alignment, coordination, access, and retention. And so I'm going to go a little bit more into depth on each one of these so you can see why this works better. And so first, looking at enhancing through alignment, we can talk about aligning, for example, social emotional learning across tiers. And so having, this consistent language where we talk about, say, being able to use a breathing technique to calm oneself down, that can be embedded into an SEL expectation, right? So we have this for being responsible as, knowing your body and responding to your body's cues. So taking a deep breath and counting to 5, that might be a way of, a quick reset for a student. That can be embedded also in the universal curriculum. So when we talk about, using that throughout instruction, throughout the day, as part of both teaching those expectations as part of the universal curriculum on practicing the skill and the logic behind that. In Tier 2, we can use small group SEL interventions to further the use of, that technique, or even expanding those techniques. And then in Tier 3, providing intensive support to, additional practice opportunities, more time and instruction on those same skills. And so what that looks like, as I mentioned, we are responsible listening to your body signals, using a calming routine in Tier 1. In Tier 2, that's going to be more targeted instruction, small groups of students, over a period of time, a couple times a week, on identifying those signals, practicing other routines. And then in Tier 3, that might take daily instruction, reminders and cues for that student. Maybe there needs to be more intensive instruction on, anticipating unique triggers for that student and signals, and then reinforcing practice opportunities, providing additional practice opportunities for those students. But when we have that embedded throughout the tiers, the student that is engaged in Tier 3 services is still going to pick up, in Tier 1 instruction, what a calming routine is, because that's something that every student knows. And all of a sudden, that's additional opportunities for practice for that student, in addition to all students that maybe don't need that level of support. But that's the idea of this integration, where all of a sudden it's going to be more effective even for those Tier 3 students if we're only doing it if even with a Tier 1 intervention. Enhancing through access, and John did a great job of talking through SBIRT and how that system works. This idea of screening is an aspect that's really important for particularly Tier 2 and Tier 3 services. But even in Tier 1, when we're talking about access through ISF, we're talking about all students get instruction, right? We just talked about this SEL skill, being able to calm yourself using this routine. If every student is getting that instruction, all of a sudden that's compared to a system that doesn't have that instruction. Students have a lot more ability and access to those skills than maybe otherwise. Additionally, providing caregivers with information around those. I actually, I love my school district locally because they're sending home almost weekly newsletters about what my kindergartner was learning as far as social emotional skills on taking breaks and asking for help. And it was wonderful. And I could, of course, I do this work regularly, so I'm aware of those things. But for families that may not have had an idea of what those skills could look like or what their students are talking about, this is going to be incredibly helpful for embracing, common language between home and school too. In Tier 2 and Tier 3, having a systematic screening in place gives an idea of what students need services earlier. And that's the most important part about screening, is catching students before they fall further down that line and before problems are harder to help students kind of self-correct or correct. But being able to funnel students into school-based services and having caregivers engaged earlier to reinforce those skills at home, we're talking about trying to get ahead of things as much as possible. In Tier 3, there might be also more referral to partners in the community, as opposed to just, well, your student needs some services and we don't necessarily have connections. Maybe you can call. I worked in Iowa. It's like maybe you can reach out to Iowa City if you need additional, screening or whatever, because there are only so many things in the school that we have capacity to assess and provide recommendations for. And this slide could have fit earlier in the screening section or here. I just like including it because it gives a sense of this chunk of students that we could very well be missing. You could very well be missing within your schools right now. There are always going to be students that we identify that are struggling, and that's not a surprise. Sometimes they identify themselves to us in different ways. And there's going to be this chunk that are not identified, but there's this in-between chunk, these students that are probably at risk, right? That we don't know about, that screening can identify. And what research tells us is that there's an additional probably 20% of students, almost 20% of students that are going to benefit, are going to be at risk and benefit from some kind of programming beyond what we've already provided. And having that number in your head, well, if there's that many that could use, say, a targeted intervention, dealing with anxiety, well, what could that prevent down the line? And that's where this, these elementary staff that we have here come into play, right? If you can screen this earlier and start implementing these interventions earlier, we can stop that kind of downstream effect that can lead to substance misuse. And there's a circle in case you missed it. And so this is what that access can look like. This is a worked out example. And I probably talked through more of that already than you need a repeat. But, using in tiers 2 and tier 3, the expert and craft to screen, identifying, the supports that they need along the way. This is a much more worked out example of what that access can look like. Enhancing through retention. And this is more explanation of why, right? We've got, why are we going to be able to retain more students and services that are taking place in school? Well, we've got easier access. There's lower cost for parents. Almost all the time it's free. If not some kind of sliding scale, for outside services might be coming in. It's also logistically easier. So we have services in schools. There's no additional appointments to drop off. You don't have to leave school during the day because most services are going to take place during the school day anyway, whether it's in or out of school. We can also monitor better, right? We can monitor progress of students. We can understand their attendance of the intervention. And, we don't want to put necessarily everything on schools, but the more that a school manages, the more information that we have, the more, I guess, change we can affect, the more timely we can make adjustments to programming. And then, the proactive problem solving in school. If things aren't going well within, a given, counseling, intervention, we've got data that indicates that we need to change something. We can do that proactively within ISF. And then lastly, enhancing through coordination. We can embed expertise across teams. We can bridge that connection between schools and communities, community providers, and then we can also bridge that connection between families and community providers more easily because we have this common language across staff. We have this expectation within our building that, behavioral health means all of this as opposed to just individual aspects. More often than not, in my personal experience practicing as a school psych, there's just not a lot of coordination. There's not an understanding of what services are available. There's not necessarily that personal relationship that I think can help families feel comfortable in reaching out to those community providers in particular. So knowing that with ISF, I think that's going to be a better coordinated approach for everyone, not just school staff, but also for families.
So let's take a look at some of the Tier 1 programs and practices that are recommended. There is this curriculum that was developed by the Department of Education and is available, and it's under Operation Prevention. And that includes classroom resources and a parent toolkit. That curriculum was developed specifically to address the opioid crisis, but involves upstream prevention and has curriculum for all grade levels. I was pleased to see in the initial survey that some of you are already adopting and have implemented the BOTFIN life skills training. That's one of the training programs that has the strongest evidence for substance misuse prevention. And when it's paired with Strengthening Families program, again, that's how to engage the parents and provide some parenting skills. It has a stronger effect than just the life skills training program alone. So that's recommended to pair those two. There's been some movement on the impact of mindfulness interventions, and so that's something to consider. as well as positive action. And I did see paths that was also mentioned in the survey, and those are very important universal programs that can be implemented. And SAMHSA has, this is a Substance Abuse Mental Health Services Administration. They have resource guides, and I'm going to go over a vaping guide here in a minute. But let's take a look at one of the universal interventions. This is provided by the Michigan Model for Health. Sean and I gave a couple webinars last month to the state of Michigan, and we're pleased to see that they have this universal curriculum that's available for the schools. It advocates for a drug-free environment, looks at the influences of alcohol and drug use, advocates for reducing teen and alcohol drug use, access to reliable information and resources, how to avoid exposure and develop refusal skills, because we know that peer influences has a very strong impact on an individual's use, and supporting others who want to stop using. And so their curriculum is actually available and it's been implemented in many states, but that's an example that you might want to draw upon if your state does not have a similar curriculum that's available. If we look at the Tier 2 programs and practices, as we mentioned earlier, having trauma-informed training is kind of critical, because we know that families and students are impacted by the opioid crisis. Sean also mentioned Coping Cat as a way to address anxiety and alternatives to substance use. Grief and loss is also something under consideration, given the impact of the opioid crisis. And how to leverage the check-in, check-out program to help reinforce some of the skills that may be used in the Tier 2 and Tier 3 interventions. And Sean, do you want to expand on that just a bit, or we're running out of time, really, aren't we? Yeah. And so I'll move through this. There's also the Project Towards No Drug Abuse. That is an evidence-based program that's available on Blueprints. And again, if you go to the SAMHSA store, there's a lot of resource guides at the Tier 2 level. At Tier 3, we've already mentioned, I'm not seeing Tier 3.
I'm sorry about that.
Yeah. Involving the LADC counseling services. Again, we need to think about mental health counseling services for those who, because we know that those with mental health issues are at heightened risk for substance abuse. How to leverage social worker support for students and family to better access community resources. That's often known as wraparound. There's now a trend for recovery high schools for those who have substance use disorders, and to get them into remission and hopefully back integrated in the main school. And then we also have a resource guides at SAMHSA. So let's skip this next slide, which drills down on wraparound. I really want to make sure to present the vaping evidence-based programs. These programs, there is this resource available. The link is going to be posted in the chat. There's a Tier 1 program called Smokescreen. It leverages technology and a gamification approach to engage the students and to explain how using tobacco products, including e-cigarettes, affect their health and lives. It helps to promote refusal skills to resist the use of tobacco products, especially including vaping, and summarizes how the media and tobacco marketing aim to influence teens to use their products. We've seen this historically with cigarettes, and an example was like Joe Camel trying to appeal to kids. And then there's a Tier 3 program. This is quitting. Both of these programs are free. This is free and anonymous text messaging program from the Truth Initiative. It's designed to help young people quit vaping. One of the key aspects of this is that it prompts to set a quit date. That's one of the initial steps towards tobacco cessation or vaping cessation. Until someone commits to a quit date, they're less likely to actually stop using. And throughout the program, users can text COPE, stress, slip, in case they do have a slip or a lapse, to receive instant support. So these are some emerging practices that are recommended by the Substance Abuse Mental Health Services Administration. We have about 3 minutes left. I'm wondering, Sean, let's do a summary here. Substance misuse is one aspect of a broader behavioral health agenda. And again, we want to break down the silos. PBIS and ISF can be used to address behavioral health. And PBIS can streamline and enhance substance misuse services for students and families. And those, we're revisiting them. Hopefully you learned a little bit from this. We have 2 minutes. I want to see if there was a question posted in the chat earlier. And so we might want to take a look at that. But Sean, can you click to the survey link so that at least people will have access to that survey to provide us feedback? And so in a school environment, have you found any concern over the use of the word retention as used here? Just curious. Sean, do you have a?
Oh, right, because retention means something in terms of, like grade retention. There's a terminology conflict somewhat there, but you're the first person to bring up like whether or not that would go that way. I'm going to read the rest of your comment here. I realize you mean retention in schoolhouse, but I wonder if that most would go. Steps thinking would go if used with them. So I mean, I think if you're specific and like retaining in services, I think like elaboration is probably the only thing that would need to be done there. But yeah, that's something that's often used in like the mental health field that we don't use that way in schools because it means grade retention. Good clarifying question.
Yeah. And I know we're running out of time today. If you want to follow up with direct questions for Sean and myself, our emails are in the chat and they will be in the PDF that we distribute. And please, we would appreciate any feedback on the webinar to help with improvement, the quality improvement for the future as well. And so thank you for your time today. Our time is up. It's 9:30. And we do appreciate the engagement and that a lot of you stuck with us for the entire 90 minutes. And I had that freak out when we thought it was only 1 hour. So I'm glad that we're all on the same page. Yeah. So thanks, everyone. Have a good day.
Thank you.